Okay, so let's get right to the big one, the question that's probably on a lot of people's minds. Isn't this just sadness? Like really, really intense sadness? And that's a totally fair question. It's easy to see why people think that. But as we're about to find out, they're actually two very, very different things. So here's a good way to think about it. Everyday sadness, that's a normal human emotion. It's usually tied to something specific, right? A bad day at work, a breakup, and it's temporary. It passes. Clinical depression, on the other hand, is a whole different ballgame. It's a persistent mood disorder, and the two biggest giveaways are how long it sticks around, we're talking at least 2 weeks, and how much it messes with your daily life. It actually affects your ability to just function. Getting that difference is absolutely key. It's the foundation for everything else. So now that we've cleared that up, let's dig a little deeper into what depression really is. Okay, so here's the official clinical take. Depression is a mood disorder that causes a persistent feeling of sadness and a loss of interest. But here's the part that I think is so important to grasp. Look at how it affects you. It's not just your mood. It changes how you think, how you feel, and how you behave. It's this all-encompassing thing that can really take over. And, it's not just one single thing. Depression is really more of an umbrella term. Underneath that umbrella, you've got several different distinct conditions, and they all have their own unique features. Let's check out 2 of the most common types you'll hear about. First, you have major depression. Think of this as intense episodes with severe symptoms that last for at least 2 weeks. Then you have something called persistent depressive disorder. This one's more of a long-term, chronic thing. The symptoms are often milder, but get this, they last for at least 2 years. So it really boils down to how severe it is and how long it lasts. And believe it or not, the list keeps going. There are other, more specific types. For instance, there's a condition in children called DMDD, which shows up as major irritability. There's PMDD, which is tied to the menstrual cycle. And sometimes depression can be a direct result of another medical problem, like chronic pain or heart disease. So even if we just look at major depression, there are different flavors or specifiers. You've probably heard of seasonal affective disorder, or SAD, right? That's one. There's also what's called peripartum onset, which you might know as postpartum depression. And there's even one called atypical depression. And why does all this detail matter? Because figuring out the specific type is absolutely crucial for finding the best way to treat it. Okay, so we've got a handle on what depression is and its different forms. Now let's switch gears and talk about who it affects, what it actually feels like to go through it, and what might be going on underneath the surface. I want you to really let this number sink in. 1 in 6. 1 out of every 6 adults in the US will experience depression in their lifetime. That's huge. This isn't some rare thing that happens to other people. It's an incredibly common part of the human experience. And that's the lifetime number. If you zoom in on any single year, about 7% of adults are actively dealing with it. It just goes to show you how widespread and really how present this is in our communities right now. So what does it actually feel like? Well, it's so much more than sadness. Imagine not caring about the hobbies and activities you used to live for. That's a big one. Or your sleep is all messed up. Either you can't sleep or you can't get out of bed. Same with your appetite. You just feel drained, no energy. It can be hard to even think straight or remember things. And it's not just in your head. It can show up as physical pain. And of course, the most critical symptom we have to talk about is thoughts of self-harm. This naturally brings us to the big million-dollar question. What causes it? Is it brain chemistry? Is it genetics? Is it just a reaction to tough stuff happening in life? Well, the short answer is, it's complicated. Yeah, the single most important thing to get here is that there's no one single trigger. It's more like a perfect storm of different factors. Sure, brain chemistry can be a piece of the puzzle. Genetics, for sure, you're actually about 3 times more likely to have it if a parent or sibling does. But then you layer on stressful life events, and even things like chronic illness or side effects from medication can play a part. It's a mix of all these things. Okay, I know that all might sound a little heavy, but here's where we pivot. Because the most important part of this entire conversation is this. There is so much hope. So let's talk about treatment, because help is not just out there, it's incredibly effective.
Okay, if you remember one number from our whole chat today, make it this one, 80 to 90%. That's the percentage of people with depression who seek treatment and eventually respond well. Think about that. That is an amazing, powerful, hopeful number. The bottom line is treatment works. It really, really works.
So how does a doctor actually diagnose it? Well, they're looking for a specific pattern. They need to see at least 5 of those key symptoms we talked about happening nearly all day, every single day, for at least 2 weeks straight. That's how they can tell the difference between clinical depression and just a really bad couple of weeks. When it comes to treatment, think of it like a toolkit. There isn't just one tool, there are many. The cornerstones are usually psychotherapy, talk therapy, and medication. But there are other things that can help, like complementary medicine. And for the really tough, severe cases, there are even high-tech options like brain stimulation therapy. The whole goal is to find the unique combination that works for you. And look, on top of professional treatment, self-care makes a huge difference. It's a support system for your recovery. We're talking about the fundamentals, right? Getting regular exercise, trying to get good quality sleep, eating well, and staying connected with people you care about. These things don't replace treatment, but man, they can really help improve symptoms and just boost your overall well-being. All right, let's bring it all home. We'll wrap up by looking at the long-term picture, and this is the most important part, where to turn for help if you or someone you care about needs it. So if there's one final thought I want to leave you with, it's this. Recovery isn't just some far-off possibility. For people who get treatment, it's the most likely outcome. With the right help and the right support, people with depression can, and they absolutely do, go on to live healthy, happy, fulfilling lives, period. But, and this is a big but, getting help early is so important. If it's left untreated, depression can get worse, and it can start to affect your physical health too. It's simple. The sooner you reach out, the sooner you can start on that path to feeling better. And right now, if you or anyone you know is in a crisis, please listen closely. The number you need is 988. That's the Suicide and Crisis Lifeline. It's totally free, it's confidential, and someone is there to talk 24 hours a day, 7 days a week. Please don't ever hesitate to make that call. So I want to leave you with a question to think about, whether it's for yourself or maybe for someone you're worried about. What's one small step you can take for your mental well-being today? It doesn't have to be huge. Maybe it's just getting outside for a walk. Maybe it's texting a friend. Or maybe it's just looking up therapists in your area. Whatever it is, remember that every single small step forward counts.